Veterans, you're getting this wrong and it's costing you big time. Too many veterans are losing thousands of dollars every year because of simple mistakes such as not taking advantage of the Medicare premium refunds for veterans. My dad, a Vietnam-era veteran, gets a $175 monthly Medicare premium refund of the $185 monthly Medicare premium. That means he is only charged $10 monthly for Medicare instead of $185. I'll show you this in a moment when I show you the video I made inside his Medicare.gov account showing he only pays $10 monthly for Medicare. His Medicare plan has a $0 premium, and it also adds dental, vision, hearing, gym membership benefits, and more. It is a $0 premium because, like you, he's already earned and paid for it. He's had tens of thousands deducted from his paychecks through the FICA box. The FICA box on our paychecks, it funds our Social Security and Medicare. The mistakes being made are ones that no one warned you about. Let's make sure that doesn't happen to you. If you think VA healthcare or TRICARE for life means you don't need Medicare, stop right there. You might be entering a huge financial trap that could cost you more than you ever expected. This is one of the biggest Medicare mistakes veterans make, and it's draining their wallets in ways they don't even realize. Veterans not having Medicare doesn't make sense because of the Medicare premium refunds available for veterans. Some veterans are getting hit with lifetime penalties. Yeah, you heard that right, lifetime. Higher Medicare premiums every single month forever. Others are missing out on Medicare refunds, leaving thousands of dollars on the table, money that should be back in their pockets. And the worst part, nobody is telling veterans. Imagine working hard your entire life, paying into Medicare, believing you're fully covered, only to find out too late that you're not. That's the reality for too many veterans. I see it all the time. The bills start piling up. They get hit with penalties, gaps in coverage, or even worse, lose benefits they thought they had. But this doesn't have to be you. You do not need to fall into these traps. Today, I'm setting the record straight. I will expose the biggest Medicare mistakes veterans make, and more importantly, show you exactly how to avoid them. Because here's the deal. If you don't know the rules, you're the one who pays. But if you stick with me, you'll know exactly how to protect your health care benefits and wallet. I'm Chris Duncan, certified Medicare insurance planner and retirement income certified professional, and we only work with veterans here. We are specialists for veterans and their Medicare options. The best part for you is the Medicare rules are set up so we provide all of our services free of charge to you, the veterans, and we are still able to make a living. By the end of this video, you could be saving yourself thousands of dollars, so don't go anywhere. This information is too important to miss, and I'm going to show you my dad's Medicare premium refunds right now. So here we are logging into my dad's Medicare.gov account, and we're going to show you where my dad only pays $10 for his Medicare premium. So here is the main page. They call it the dashboard. This is his Medicare Part C plan that he has down here. I have that blocked out because the insurance companies like me to do that. One of the things that we're able to do is we're independent, so we don't work for these insurance companies. So that frees us up to find the plans that are specifically for veterans and that also have the highest refunds and most benefits. But you just come up here to your name and you go to My Premiums. You click on that and that'll open this page here. And you'll see under My Premiums on my dad's that his current monthly premium for his Medicare Part B is $10.30. And you click on Premium Details and it'll show you some more. Shows you right here the Part B amount. This is the $185 monthly premium. This is the standard amount for most people, $185. If he didn't have this plan, he would have $185 taken out of his Social Security benefit every month for Medicare, and he would add no other extra benefits, and he would be able to go see doctors on Medicare, but he would have huge deductibles and copays that he would have to make. You'll see he has no Part B late enrollment penalty. He has no Part B IRMA amount. What that stands for is your income-related monthly adjustment amount. That's for high-earning individuals, at least what the government says is high earning. They can add an extra $500 to your premium. And then right here, MA plan, payment, Part B premium, negative $174.70. His Medicare Part C plan pays $174.70 of his Medicare premium. So that means only $10.30 comes out of his Social Security benefit for Medicare. Now, if he didn't have Social Security, if he was paying the bill directly, instead of getting a $185 monthly bill, he'd be getting a $10.30 monthly bill for Medicare. And if you hover over this I spot, it says some Medicare Advantage plans pay all or part of your Part B premium. So this is what I'm talking about when you're getting the Part B premium refunds with these plans. Some of them are designed specifically to do this and add the other benefits. So we'll move on here. Too many veterans are making one costly assumption. They think VA healthcare or TRICARE for life means they don't need Medicare. And that single mistake, it's draining their wallets, costing them thousands, not just in lifetime penalties, but also in missed Medicare premium refunds like you saw that my dad is receiving. He isn't receiving this because he is low income or high income. Income doesn't matter. You qualify regardless of your income level. If you have Medicare Part A and B, these refunds will put money back into your pocket every single month. And here's the part that frustrates me the most. Most veterans have no idea they're losing this money until it's too late. Nobody calls you up and says, hey, you're missing out on thousands of dollars in Medicare refunds. Nobody warns you about the permanent penalties if you don't enroll on time. And by the time you find out, you've already lost thousands. I get it. The system is confusing. You've served your country and are now told you need another type of coverage. It doesn't make sense at first. After all, you already have VA healthcare or TRICARE for life, so why would you need Medicare too? Well, here's what the VA and TRICARE don't always tell you up front. They are not the same as Medicare. They don't work like a replacement and don't always cover what you think they do. Believing that VA or TRICARE covers everything is a massive mistake that could leave you stuck with surprise medical bills or even losing coverage altogether. Now let's talk about penalties. Because this is where many veterans get blindsided, if you wait too long to sign up for Medicare, you could be stuck with lifetime penalties. That's right, lifetime. The longer you wait, the more you pay every single month for the rest of your life. These aren't one-time fees. These aren't temporary increases. They never go away. Let me give you an example. I've seen veterans forced to pay 50% more for their Medicare premiums every single month forever. Why? Because they didn't enroll on time. And the worst part, nobody warned them. But penalties aren't the only way veterans lose money. Let's talk about something that could actually put money back in your pocket, because I don't just want you to avoid losing money. Here are the 5 biggest Medicare mistakes veterans make. Number 1 is not taking advantage of Medicare refunds. Veterans, you could be getting money back. Most of you have no idea. Let me ask you something. Are you paying full price for Medicare Part B? If so, you're throwing away money every single month. Like I showed you, there's a way to lower your costs or even get a full refund of your Medicare Part B premium. You saw my dad, he gets $175 of his $185 Medicare premium refunded back to him by his $0 premium Part C plan. I know it sounds too good, but it's real. The problem is, most veterans don't even know it exists. That's because no one is telling them. The VA won't call you about it. Social Security won't send you a letter. Medicare isn't going to knock on your door and hand you a check. If you don't check for yourself, you'll never know if you're eligible, and you could be leaving thousands of dollars on the table. We have thousands of clients taking advantage of this, but don't just take my word for it. Go into the description of this video and go to our testimonials page. Our average client receives a $110 monthly Part B premium refund. So what is a Medicare Part B refund? Every month, Medicare automatically deducts your Part B premium from your Social Security benefit if you receive your Social Security benefit, or they send you a bill for the Medicare premium if you are delaying your Social Security benefit. Right now, the standard Medicare Part B premium is $185 per month. That's $2,200 per year. But what most veterans don't realize is that some Medicare plans are made precisely for veterans with VA health benefits and/or TRICARE for life that refund part or up to all of the premium back to you. This is called the Medicare Part B giveback or Part B refund. Let's break that down. If your Part B premium is $185 and your plan refunds $100 monthly, you'll have an extra $1,200 per year in your pocket. If your plan refunds the entire premium, that's $2,200 per year you could be saving. This isn't a one-time payment. Money is returned to you every month. My dad gets a $2,100 a year refund. That means Dad only has to pay $120 for Medicare for the entire year. His Medicare plan includes dental, hearing, vision benefits, and more. It also has a $0 premium because he has already paid for it and qualified for it through the tens of thousands that were deducted from his FICA box on his paychecks his entire working life. And here's the thing, most of you never check because, as you know, the government doesn't exactly make anything easy. Why doesn't the VA or Medicare tell veterans about this? Because they don't have to. These refunds aren't automatically given out. You have to know where to look and apply for the right plan to start getting money back. And let's be honest, the government isn't in the business of making sure you pay less. This is why so many veterans miss out. They assume their Medicare costs are set in stone. But the truth is, many are overpaying when they don't have to. This money is yours. Don't let it go to waste. Let's talk about what an extra couple $1,000s a year could mean for you. Maybe it means covering your bills without worrying every month. Maybe it means taking that trip you've been putting off. Maybe it means having extra peace of mind, knowing you're keeping more of your hard-earned money. Whatever it is, the money belongs to you, and the only thing standing between you and getting it back is checking to see if you qualify. Veterans, don't let this opportunity pass you by. If you qualify, you have two choices. Check today, claim your refund, and start getting money back every month. Ignore this and keep overpaying while that money disappears forever. Which one sounds better to you? The answer is obvious. Don't leave thousands of dollars on the table. Find out if you qualify today. Number two is that too many veterans assume that VA healthcare is complete replacement for Medicare. They think, I served my country, the VA will cover me for life. But here's the harsh truth. The VA is not the same as Medicare, and if you don't have both, you could be walking into a financial disaster. Here's why VA healthcare alone is not enough. First, the VA can deny your care, and they do it more often than you think. My dad was just rejected for a treatment by the VA a few weeks ago, but we didn't panic. We just used his Medicare Part C plan. He saw providers outside the VA, and he received the treatment that way. He had some copays to make, but they were very manageable. The VA has strict rules about what they'll cover, and a lot of it depends on whether your medical issue is service-connected. That means if you need a procedure, medication, or specialist that isn't directly tied to your service, they can say no. This is why the VA recommends you have Medicare too. They admit you can't count on them because they never know when their funding is going to be cut. This is evident in today's political environment. That's how veterans end up with massive medical bills they weren't expecting. They thought they were covered, but the VA says, nope, this isn't service-related, and suddenly they're stuck trying to figure out how to pay for care they assumed would be free. And here's another huge problem. VA facilities aren't everywhere. What happens if you get sick or injured and the nearest VA hospital is hours away? What if it's the middle of the night and you have a medical emergency? Are you really going to drive that far just to get treated? Community care is great. My dad uses it, but the VA doesn't always have to cover you at ERs outside of the VA system. There are specific criteria that need to be met, and if the criteria aren't met, the VA isn't responsible for covering your visit. Let's be honest, you're going to the nearest hospital, but here's the catch. If you don't have Medicare and you go to a non-VA hospital, you could be responsible for the entire bill. I've seen it happen. Veterans rush to the ER thinking the VA would cover them, only to get a $50,000 medical bill in the mail. Why? Because the VA didn't authorize the visit and they didn't have Medicare to back them up. This is why having Medicare is critical, and it's pretty stupid for veterans not to have Medicare too because of the premium refunds that are available to veterans. When you have Medicare, you have options. You can see doctors, and you can go to any hospital for an emergency without having to worry if you satisfy the rules for the VA to pick up the bill. And if you have TRICARE for life, Medicare is required. Without Medicare, you lose your TRICARE for life benefits. This is why so many veterans make a huge mistake by ignoring Medicare. They assume the VA will always take care of them, but the truth is, it won't always be there when you need it. I'm not bad-mouthing the VA. The VA is great. My dad gets excellent care at the VA, but like he says, the VA is great, but it ain't perfect. And by the time you realize that, it could be too late. So let me ask you, do you want to take that risk? Or do you want to make sure you're covered so that no matter what happens, you'll always have access to the care you need? I think the choice is obvious. Don't rely on VA healthcare alone. Get Medicare and protect yourself. Number 3 on our list is veterans missing the enrollment deadline. Too many veterans don't realize that Medicare has strict enrollment deadlines, and the consequences for missing them are brutal. Many believe their VA benefits exempt them from the penalties. I've seen veterans make this mistake, and let me tell you, it's one of the most expensive Medicare mistakes you can make. Let me be crystal clear. If you miss your Medicare enrollment window, you don't just sign up later and move on. You will pay a penalty every single month for life. And these aren't one-time fees. These penalties never go away. They keep adding up, and you'll be stuck paying more than you should for Medicare forever. So, why do veterans get caught off guard a lot? Veterans assume they don't need to worry about Medicare because they have VA health care or TRICARE for life. But here's the truth. Medicare has its own rules. The VA is not Medicare. If you skip Medicare because you think the VA will cover everything, you could end up paying out of pocket for care or stuck with massive penalties when you try to enroll later. If you have TRICARE for life, you must have at least Medicare Parts A and B. No Part B, no TRICARE for life. With A and B, you are eligible for Medicare Part C, and Part C is the only place where Medicare Part B premium refunds are available to veterans. I've talked to veterans who ignored the deadline, thinking they could sign up whenever they wanted, only to find out the hard way that they were stuck waiting months for coverage and paying way more than they should. Here's how the Medicare enrollment deadline works. You become eligible for Medicare at 65, and if you don't have creditable health coverage at work, and VA is not creditable coverage, you must enroll in Medicare to avoid the penalties. You only have a 7-month window to enroll. That window starts 3 months before your 65th birthday, includes your birthday month, and ends 3 months after. If you're already receiving Social Security benefits, Medicare will enroll you automatically, but if you're not receiving Social Security, you must sign up yourself. If you miss the deadline, you can't just sign up the next day. You have to wait until the general enrollment period, which only happens once a year from January 1st to March 31st. That means you could be without Medicare for months, and then comes the worst part, the late enrollment penalty. The Medicare late enrollment penalty, this never goes away. If you don't sign up for Medicare Part B on time, you'll pay a 10% penalty for every 12 months you were eligible but didn't enroll. If you wait 5 years, you'll pay 50% more on your Medicare premiums for the rest of your life. The penalty is permanent, doesn't go away no matter what. Let's break that down. The standard Medicare Part B premium is $185 per month in 2025. If you delay enrolling for 5 years, your penalty would be 50% more, meaning you'd pay an extra $90.50 per month forever. Because the penalty is a percentage and not a fixed amount, as Medicare premiums go up, so does your penalty as you get older. Now imagine waiting 10 years. That's a 100% penalty, meaning you'd pay double what everyone else pays for life. I've seen veterans in their 70s and 80s paying hundreds of dollars more each year just because no one told them to sign up on time. This is not a risk you can afford to take. I don't want you to be the next veteran stuck paying extra every month just because no one warned you about this. If you're turning 65 soon, you must enroll in Medicare during your initial enrollment period if you don't have any qualifying creditable coverage. Do not assume the VA or TRICARE will cover everything. If you're already getting Social Security, Medicare will enroll you automatically and automatically deduct the Medicare premium from your Social Security benefit. But don't panic, because you will have Medicare A and B, which means you qualify for Medicare Part C, and the correct Part C plan can refund up to all of the Medicare premium being deducted from your Social Security benefit. These Part C plans have a $0 monthly premium because you've already earned them with the tens of thousands of dollars you paid into Medicare your whole working life. The FICA box is what funded your Social Security and Medicare. If you're not taking your Social Security benefit yet, you must take action and sign yourself up. Here's the good news. If you enroll on time, you'll never have to worry about these penalties. You'll get full access to Medicare benefits, and you can even get a Medicare Part B refund to put money back in your pocket. So don't make the mistake of thinking you can enroll whenever. This is a one-shot deal, and if you miss it, you will pay the price every single month for life. Number 4 is skipping Medicare Part B because of TRICARE for life. This mistake just doesn't cost you money. It could completely strip away your TRICARE for life benefits. And once those benefits are gone, getting them back isn't as simple as flipping on a light switch. You could be left without coverage for months, stuck paying thousands in medical bills, and forced to deal with penalties that never go away. I see this mistake far too often. A veteran assumes I have TRICARE for life, so I don't need Medicare Part B. They figure their military earned benefits will always be there no matter what. But here's the hard truth. TRICARE for life is not a standalone plan. It is not an alternative to Medicare. It's secondary coverage, and it only works if you are actively enrolled in at least Medicare Part A and B. That means if you skip Medicare Part B, you don't just get hit with a penalty, you lose your TRICARE for life benefits entirely. No doctor visits, no specialist care, no outpatient procedures. Most veterans skip Part B because they simply don't want to pay the Medicare Part B premium. But with Medicare Part C plans specifically made for veterans, you will have access to getting a lot of that Medicare Part B premium refunded back to you every month. Now imagine this scenario. You could go to the doctor for a routine checkup. Maybe you're having some joint pain, or maybe your blood pressure is creeping up. You're expecting TRICARE for life to pick up the bill, but instead, you get hit with a massive charge because you're no longer covered. You call TRICARE to ask what's going on, and they tell you your coverage was terminated because you never signed up for Medicare Part B. Suddenly, you're not just without TRICARE, you're also stuck with 100% of the medical bills. And here's the worst part, you can't fix this mistake right away. If you try to sign up for Medicare after missing the deadline, you have to wait until the next general enrollment period, and that enrollment period, it only happens once a year. If you miss the window, you could be left without Medicare and without TRICARE for life for months. That means every doctor visit, every prescription, every lab test, you're paying out of pocket. If you don't sign up for Medicare Part B when you're first eligible, you don't just get to enroll later without consequences. You are permanently stuck paying a penalty every single month for the rest of your life. So here's what you need to do to avoid this nightmare. If you're turning 65 soon, enroll in Medicare Part A and B on time. Even if you have TRICARE for life, you still must have Medicare Part B. There are no exceptions. Veterans, I can't stress this enough. This is one of the most devastating mistakes you can make. If you don't enroll in Medicare Part B, you will lose your TRICARE for life benefits. And by the time you realize it, it may be too late to fix it without major financial consequences. I know this system is frustrating. I know it's confusing, but I also know this. If you ignore this rule, you will regret it. I've seen it happen too many times. Don't take that risk. Get enrolled. Protect your benefits and make sure you never lose the healthcare coverage you've earned. Number 5 on our list is not understanding how Medicare and TRICARE for life work together. Veterans, this is where so many people get it wrong, and get it wrong could cost you big time. If you don't understand how Medicare and TRICARE for life work together, you could lose coverage, rack up unexpected medical bills, or be denied care when you need it most. Too many veterans assume TRICARE for life will take care of everything, but that's not how it works. TRICARE for life is not a replacement for Medicare. It's designed to work with Medicare, not instead of it. And if you don't have both, you could be left paying thousands out of pocket. Here's the way it really works. Medicare is always the first payer. That means when you go to the doctor, have surgery, need physical therapy, or get any other kind of medical treatment, Medicare covers the bill first. Once Medicare pays its share, TRICARE for Life steps in and picks up what's left. And here's why this setup is so powerful. When you have both Medicare and TRICARE for Life, you'll have little to no out-of-pocket costs. No expensive deductibles, no surprise medical bills, no stress about how you're going to pay for care. But here's the critical mistake I see veterans make. They think, I have TRICARE for Life, so I don't need Medicare. They figure that TRICARE will just cover everything, but that's not how it works. If you don't have at least Medicare Part A and B, TRICARE for Life won't cover you. And Part C also works with TRICARE for Life. That means TRICARE for Life covers all of the deductibles, copays, and coinsurance for you. So virtually nothing comes out of your pocket for your medical services. And the only reason I say virtually is because we all know there is always some surprise $100 aspirin we have to pay for at the hospital. If you skip Medicare Part B, TRICARE for Life can't cover you. Also, if you skip Part B, then you don't qualify for Medicare Part C and the Medicare Part B premium refunds. Medicare isn't paying first, so TRICARE won't pay second. That leaves you on the hook for the entire bill. Imagine thinking you're covered, going to the doctor for a routine checkup and then getting a massive medical bill in the mail. You call TRICARE only to hear the worst possible news. Your visit wasn't covered because you didn't have Medicare. And like I've mentioned, if you don't enroll when Uncle Sam tells you to enroll, then you have the lifetime penalties. With the Medicare premium refunds available for veterans from Medicare Part C plans, it doesn't make sense not to get everything set up when Uncle Sam says that you should. So here's the solution and how to avoid these mistakes. Now that you know the biggest Medicare mistakes that cost veterans thousands of dollars, let's discuss how to avoid them altogether. Because here's the thing, every single one of these mistakes is preventable. You don't have to be stuck paying lifetime penalties, losing your TRICARE for Life benefits, or missing out on Medicare refunds, but you have to take action. The worst thing you could do is assume everything is set up correctly, only to realize too late that you made a mistake that cost you money, benefits, or both. So let's break down exactly what you need to do right now to ensure you're fully covered, not paying, and getting every benefit that you've earned and paid for. Speak with an expert to make sure you're getting every benefit you've earned. Medicare is complicated. TRICARE for Life is complicated. VA benefits are complex. Trying to figure it all out on your own is a recipe for mistakes, and those mistakes can cost you thousands. We talk to veterans every single day who are confused about their benefits. They don't know if they're making the right choices. They don't want to risk losing coverage, overpaying, or missing out on money they should be getting back. And here's the reality. Most veterans are either overpaying for Medicare, missing out on benefits, or at risk of losing their TRICARE for Life coverage because they don't know the rules. But you don't have to figure this out alone. We are experts who can help you navigate your benefits, lower your costs, and ensure you get everything you have earned from your service and paid for through your taxes. Medicare rules allow us to provide our services and expertise to you absolutely free while we still make a living. You served our country, you earned these benefits, now it's time to make sure you're actually getting them. Here's what to do next. We are here to answer your questions about Part C and how Medicare premium refunds are available to you. Medicare's rules make it so all of our services are free to veterans. We only work with veterans here. You never pay us a dime. I'm Chris Duncan, certified Medicare insurance planner and retirement income certified professional. Our best phone number is 888-960-VETS. That's 888-960-8387. We owe you a debt of gratitude for your service, and remember, we speak veteran. Want to learn more? Click on one of the videos below to dive deeper into refunds, VA benefits, TRICARE benefits, Medicare, and more. If this video helps you understand your benefits better, hit the subscribe button to stay updated with the latest tips for veterans. We're always here to help you get the most from your benefits. Thanks for watching, and remember, we speak veteran. After all, these aren't just benefits, they're benefits you've earned through your service to our country. Let us help you claim them.